Hi, everyone. Welcome to Conversations with Catherine. I am thrilled to have with me today Taryn Norley. She is the president and CEO of the ALS Association Arizona chapter. I've been involved with the chapter for a number of years now. And Taryn, it's great to see you.
Yeah, it's great to see you too. Thanks so much for having me on.
Thank you. How are you holding up in this pandemic?
You know, I always say we're doing okay with everything that's going on. We're doing as well as could be expected.
Yes. Well, I want to talk a little bit about how the ALS Association is being impacted here in Arizona by COVID-19, because what a lot of people don't realize is that you are really all about providing these services for people with ALS and their families, services they rely on a daily basis. So talk to me a little bit about what's been challenging for you and how you've pivoted.
Yeah, definitely. So pivot, that's kind of the word of the day, right? Every day. How are we pivoting today? What are we doing? But we're usually with our patients a lot. And since they have a compromised immune system, we've had to kind of rethink how we're delivering, what we're doing. And so we want to make sure that they're as safe as they can be and that we're practicing everything that we can do. So we've moved a lot to virtual, a lot like other groups have. All of our support groups are virtual. Which has been good because we can still see everyone, but allowing them to stay safe and in their homes. And the other thing that we've done is and this has been challenging, we've had to limit a lot of our equipment delivery. Mm-hmm. Usually we provide a lot of equipment and we can get it to our patients, but with this social distancing and what we're practicing, we haven't been able to drop the equipment as often as we'd like. So we've taken care of emergencies, or if someone needs something immediately, we've been able to work with our company that does deliveries, and we've sent staff out, again, practicing everything safely. We're wearing our mask, we're dropping equipment at the door, and then just letting them know it's there, and then they can reach out and pick it up when they feel safe. So those are just some of the changes. Yeah.
Well, I was going to ask you about that because a lot of people may not realize that the average cost for a family with ALS is about $200,000 a year. And a lot of that comes with the equipment that is very, very needed for them to maintain themselves from day to day. So nice to know that you're able to still provide some of that, but of course it's taking its toll. And when I talk about the financial impact of this, you had Bite Night, which is an annual big fundraiser coming up in June that's now been postponed. So how does that affect the fundraising that you would normally be doing right now and that the funds that you rely on?
Yeah, it's impacted us greatly. I mean, this is one of our high fundraising periods. And so we haven't been able to do as much. We're trying to be sensitive to people that have lost their jobs or just don't have those funds to give. So it's really hard as a nonprofit to really think about when's the right time, when can we ask? And so we are down financially. You know, we're looking at about 38 to 40% that will be down in fundraising right now, which is extremely challenging. We were operating really tightly anyway, doing much better, and we had some great fundraising last year, but really we definitely need those donations to keep coming in.
Well, I'm going to provide the website in just a moment, but I do want to let people know, if they're not familiar with what ALS is. My aunt, as many people know, died from ALS a couple of years ago, but I was actually involved with the chapter before that. Several patients that I've come to know through the years who, you know, some survived, some didn't. Talk to me a little bit about what ALS does to the body, because there is no cure and the survival rate is not very long.
Yeah, so it is a motor neuron disease that affects the cells in the spinal cord and up towards the brain. And so what it does is some people can become paralyzed from this. And so they are unable to move. They are locked into their power wheelchairs, but the mind stays intact. So I think that's one of the hardest things to live with, is that the mind's still there and they may lose the ability to talk and speak. And so that's really challenging too. So ALS is just a really tough diagnosis, and to see it, I saw a quote yesterday, you know, until you actually see it and see someone go through it, you don't understand how brutal of a disease it is. And it's ugly, and you know that.
It is. It's horrifying, and it's very, very difficult on the entire family. Mm-hmm. So that's why everything that you do with the chapter is so important in our community and for our patients and their families. Tell me a little bit about, because I know, you know, what we're dealing with right now with the isolation and not knowing that if there's a cure out there for coronavirus. This is very similar to what ALS patients deal with on a regular basis, right?
Yeah, exactly. And I think someone talked to me yesterday, the similarities between ALS and COVID. It's a diagnosis that no one wants. You can see that in both of them. Symptoms do not present the same. Again, I could line up 5 ALS patients and they would all present to you differently with their symptoms. The disease course varies wildly, and that's the same between COVID and ALS, and there's still not a cure. And we say no cure yet. We always keep that hopeful aspect there, but it's been unreal to see kind of the similarities between it. And also when this broke out and we told our patients, stay home, stay safe, make sure your caregiver, and I'm glad that you brought up the caregiver to this too, make sure that they're acting almost as if they have ALS too. We want to keep them as equally as safe because they have to take care of the patient. A few of people said to us, we've dealt with this since having the disease. We stay at home, we isolate, we do all of this once we get the diagnosis. So it's been very interesting to see the similarities between COVID and
it just gives me chills. So once again, it's another reminder of why we need to continue to support what you do. Yes, I understand that a lot of us have been impacted financially, but every dollar counts. Bite Night has been moved to November, correct?
Yes, Phoenix will be November 28th. We're still working on Tucson, but yeah, we're hopeful to see what it can be. We're ready, all the staff. We just want to get back out there and fundraise and help our families.
Yes, we will be ready as well. And for anybody who is watching and wants to make a donation, they can go to the website, webaz.alsa.org. Taryn, thank you so much for all you do. You are such an angel in our community, and you and your entire staff. Just really appreciate it.
Oh, thank you, Catherine. And thank you for all your support.